Hospital at Home has emerged as an innovative and promising model that allows hospitals to provide hospital-level services in a patient's home rather than in a traditional brick-and-mortar setting. This model differs from other home-based services, such as home healthcare, in that it is a substitution for a hospital stay. Hospital at Home is for patients who need hospital-level care, but are clinically stable enough to receive care at home. Patients are admitted to hospital at home following an emergency department visit or a transfer from a traditional hospital inpatient setting. Hospital at Home provides services that are normally provided in a hospital, like diagnostic testing and specialty consultations, and services like meal preparation and delivery. Services are provided in the patient's home by clinical staff, and patients also have 24/7 telehealth connection. Nurses and community paramedics are often important members of the care team. Compared to traditional hospital care, family caregivers may play more of a role in providing their loved ones care and assisting with daily activities such as eating or bathing, but the patient and family may also prefer the experience of being at home. A national study of the hospital at home model of care found largely positive patient and caregiver feedback, and patients described feeling at peace and more comfortable while being cared for in their own space. Although hospitals have experimented with providing inpatient-level care at home for years, this model of care gained traction in 2020 when the Centers for Medicare and Medicaid Services launched its program for Medicare beneficiaries. This was amidst concern about hospital capacity during the COVID-19 pandemic. This program allowed Medicare to pay for hospital-at-home care at the same rate as traditional inpatient care. Although hospital-at-home programs represent a small share of total inpatient discharges in Massachusetts, these programs are growing rapidly. From 2020 to 2024, hospital-at-home discharges in the Commonwealth rose nearly tenfold, reflecting both the entry of new hospital programs and existing programs increasing their capacity. In Massachusetts, 9 hospitals had an active hospital-at-home program in 2024. About 2/3 of hospital-at-home patients in Massachusetts have Medicare coverage. In 2024, nearly 80% of patients had Medicare or Medicaid coverage. As such, hospital-at-home patients tend to be older. In 2024, more than half of patients were at least 70 years old, which is consistent with the average age of the Medicare population. While national analyses found hospital-at-home patients were more likely to be white and have higher income, patients that utilize hospital-at-home in Massachusetts appear to be similar in terms of race, ethnicity, and income to patients receiving traditional inpatient care at the same hospitals. As hospital-at-home programs continue to evolve, it will be important to consider possible policy implications, including appropriate admissions. To ensure that hospital-at-home is not used as a substitute for lower-cost, lower-intensity services such as home health care, program requirements should ensure that patients enrolling in a program require hospital-level care. Hospital capacity. The state should monitor the impact of these programs on hospital capacity, including the potential to relieve hospitals from emergency department crowding and discharge delays, as well as potential spending impact from hospital bed expansion. Other important issues include continuing research on the benefits of patients, including care quality and patient and caregiver experience, determining appropriate payment rates, standardizing data collection, and financial sustainability. To learn more about these policy questions and about hospital at home in Massachusetts, read the Massachusetts Health Policy Commission's policy brief, Hospital at Home in Massachusetts, Trends in an Emerging Clinical Model, available on the HPC's website.